In 2017, the Department of Justice, under Attorney General Jeff Sessions, decided to target and destroy the careers and liberty of physicians practicing medicine in a manner that insurance companies and law enforcement agents did not approve of. And the Biden administration has done nothing to correct this terrible injustice. It all started with a basic confusion on the part of the DOJ between the average practice of medicine and the usual practice of medicine, a confusion that persists today. The argument seems to be that if medicine is truly a science, then there should be just one correct way to treat someone with a particular condition. Right? So why should there be a second opinion? If medical science is so exact and doctors really know what they are doing, why would any two of them have different opinions? This question seems to convince federal law enforcement that one or the other of these physicians is practicing outside the usual practice of medicine or committing fraud and needs federal confinement therapy to get back on the straight and narrow. These attacks have destroyed the practice of pain management and addiction in America and have left tens of thousands of patients abandoned and many dead. First, no physician has ever seen an average patient, ever. That is because this human being in America would be a 49% male and 51% female chimera who was 73% white, 13% black, 5% Asian, and 9% other, with 8.3% of each of their eyes blue and the other 91.7% brown, since 16.6% of the American population has blue eyes. As nonsensical as this sounds, false metrics like these are fed into AI algorithms, which are then used to pronounce a physician as being criminal, since their treatment of a patient was not average, and therefore was outside the usual practice of medicine. Human beings are much too varied for this simplistic cookbook approach. If you think that I am being hyperbolic, let me give some examples. Dr. Xiulu Ruan was the most educated physician ever to treat pain in the United States of America. That is not my opinion. That is a fact, according to the World Record Academy. Dr. Ruan had not just one, but 7 individual board certifications. Despite the incredible dedication this accomplishment shows, Dr. Ruan's judgments on medical practice were disregarded when the DOJ's AI beast, their words, not mine, labeled his practice a pill mill because A, patients were traveling a long way to see him, B, he prescribed a lot of opiates, and C, there was a high percentage of patient overdoses. Now, let's take a look at the patients who would be referred to Dr. Ruan. And that's an important point. Other physicians were sending these patients to Dr. Ruan for a reason. That reason being, the other doctors couldn't figure out how to treat them effectively. These would be the most complicated patients possible. Patients who had been seen by primary care providers and pain experts, and no one could solve their problems. Of course, these patients would travel long distances to be seen by an esteemed expert like Dr. Ruan. The government seems to think that all of these patients should have been living next door to Dr. Ruan, but this is ludicrous. They would come from all over the country to see the only physician in all of America with these qualifications. That also means that these would be the most problematic and hardest to treat patients in the country, patients who had most likely spent years trying this procedure and that medication and were at the end of their rope, literally. If you agree to see those who are suffering the most, then you are increasing the likelihood that one of your patients will give up and use their medications to end their existence. This is a tragedy that is now compounded by the fact that the federal government will use this metric to then deprive every other patient of your physician's expertise, leaving patients with nowhere to turn. And what does Dr. Ruan's prosecution teach the rest of us? If they do not differ to the opinion of the most educated pain specialist on the planet, then what chance do you have? The message is clear. Don't accept complicated patients for pain treatment. But it doesn't just stop with pain. Even the CDC and DHHS acknowledge that it is legal to treat pain in someone with addiction, as long as the controlled medication is prescribed for the purpose of treating the pain. But now, the DOJ is targeting doctors who treat addiction also, and have managed to put hundreds of physicians in prison by convincing a jury otherwise. Look at the case of Dr. Meredith Norris. Dr. Norris had helped lawmakers develop opioid policy and treatment access decisions. In October of 2022, Dr. Norris was a specialist in both pain treatment and addiction. She had opened Graceful Recovery Drug Treatment in Kennebunk, Maine. She had helped thousands of patients manage their pain and conquer addiction. As a recognized specialist, many physicians in the area would send her the most complicated patients. Complicated patients are, by definition, unusual and will require unusual treatment. This fact alone allows the government to make outside the usual claims. This led to her being targeted by the New England Prescription Opioid Strike Force, one of several such strike forces composed of DHHS, FBI, OIG, and DEA agents, decided that Dr. Norris was outside of the usual course of professional practice and was prescribing medications without a legitimate medical purpose. Dr. Norris was accused of prescribing dangerous, highly addictive, and often diverted narcotics, which is, of course, exactly what doctors who treat pain are supposed to be doing. Who else should be deciding who gets these? The DEA. It was also alleged that at least one patient was on 1,000 MME, which they note is 10 times the recommended safe dosage from the CDC. It doesn't mention the entire categories of patients that even the CDC agreed were outside their guidelines, or the patient who is unresponsive to lower doses or comes to her already on a very high dose. All exceptions the DEA ignores. Once again, we fall into the complicated and unusual patient being used against a physician. Dr. Norris had her charts reviewed by a medical expert, Dr. Terry King. Much has been written about Dr. King, including the claim that he no longer prescribes opiates, which, in my opinion, would put him far outside the usual practice of medicine, but make him safe from scrutiny regarding prescriptions. This doctor's extreme opinions are then propagated to the jury as if they were the standard by which all physicians should practice, a national standard. Dr. Norris and Dr. Ruan are both exceptional physicians who are now being prosecuted for treating complicated patients whose medical course makes them, by definition, outside the average practice of medicine. But this does not mean they are outside what should be the legal definition of usual practice of medicine. It is usual for exceptional physicians to treat exceptional patients with exceptional therapies. The Justice Department, enabled by an AI, just as ignorant about the proper practice of medicine as they are, has displayed a complete lack of respect for a physician's training and expertise, deciding instead that since some patients have a bad outcome, they are bad doctors. The message is clear. To be safe, don't treat patients with complicated conditions and histories, and especially don't treat those at the end of their rope, because if they let go, it will be used to hang you.